So we'll move on to the next topic. He's going to talk on a randomized trial between MORYA's technique of nucleus hydroexpression versus visco expression in MSICS.
Good afternoon, respected judges. So my study is on a randomized clinical trial between MORYA's technique of nucleus hydroexpression versus visco expression in M6. So cataract surgery has evolved from an ECC to M6, phaco, and now flax and robotic surgeries, and all surgical procedures has a complication rate, and the goal and challenge for ophthalmic surgeons are to minimize them. And elective cataract surgery is associated with some endothelial cell loss, which is of particular concern as they cannot regenerate. In phaco, the loss is 8 to 25%, whereas in M6, 4 to 16% is observed. And there are various studies that have compared M6 versus phaco, but none had compared during the different steps of M6. So this was a first prospective randomized trial to analyze and compare the endothelial cell loss during M6 cataract surgery using the viscoelastic assisted nucleus removal versus the MORYA's technique of nucleus hydroexpression with basal salt solution plus. So we noticed the demography, uncorrected distant visual acuity, and best corrected visual acuity post-operatively, pre and post-op intraocular pressure, change in CCT, and pre and post-op changes in keratometry at day 1 and day 90. So it was a prospective randomized trial of 204 patients, and single surgeon performed all these surgeries in both the groups. Inclusion criteria: more than 5.5 millimeter of mydriasis, no central corneal opacity, no previous surgery, ECD of more than 2000, and group A nucleus removal using the OVD 2% HPMC, 101 cases, and group B nucleus removal using MORYA's 3-way hydrocannula and BSS plus. So there were 103 cases. So this was the design of the beveled up hydrocannula with the central large opening and 2 sideways openings. So there is no shallowness of the AC. So this is the design of the MORYA's hydrocannula. So this is a case of nucleus removal using OVD. So prolapse into the AC and it is removed. And this is a case of again SICS in which the nucleus is removed using the 3-way hydro-MORYA's cannula. So it is stuck in the, and with the swivel movement it is removed. This is such a large nucleus. So these were the results. So the mean age of the patient was 64 plus minus 8.2 years. So there was no difference in both the groups regarding the demographies and the associated systemic illnesses. The mean logMAR visual acuity for both groups on day 1 and day 90 was statistically significant with p-value of less than 0.001, but there was no difference in both the groups. Change in intraocular pressure from pre-operative to post-operative day 1 and day 90 in group 1 was 0.7% and 8.7%, and in MORYA's technique it was 2.7 and 7.5%. Endothelial cell loss of 9.7% with the OVD group and only 4.8% in the MORYA's technique of nucleus removal. Regarding the pre and post-op CCT K1, K2, no significant p-value difference. So iatrogenic surgical trauma to endothelium result in PBK and a gross reduction in visual acuity. And previous studies have compared ECD loss during phaco or compared between phaco and SICS. So we compared 2 techniques of nucleus removal using OVD and our technique. So this prospective randomized trial proves that like during PCL implantation, BSS plus can again be used for nucleus delivery with endothelial protective effect. Also, the IOP was also decreased. This was an accidental finding of up to 7 to 8% after M6, and it remained sustained for 1 year. So as per our knowledge, this is the first large scale analysis highlighting the pachymetric, intraocular pressure and endothelial cell changes during the nucleus removal by the 2 different nucleus removal techniques of a small incision cataract surgery. Thank you so very much.
Dr. ARVIND. Just one question. What was the purpose of the 3 openings? What was the thought behind the process?
Yeah. So the thought was so that there was, when we remove the nucleus, so there is no AC prolapse. So if sideways, if the fluid is coming out, so there is no nucleus prolapse.
Does that also help in levitating the nucleus?
Yeah, it helps. It helps.
Because 2 are directed towards the side and 1 is directed superiorly.
Yeah.
So
Definitely
my thought goes that it probably helps in levitating the nucleus and pushing it out.
It engages in the tunnel quite easily, and removal is by the swivel method. Yes, of
Thank you.
course.